Good morning, everyone. Okay, so today I am going to start with a very important and interesting topic, that is pharynx. Okay, it is a lengthy topic. There are so many things which we have to discuss in the pharynx. Okay, so most probably I will divide it into two classes. If required, third class will also be taken. Okay, pharynx is extremely important topic in head and neck chapter. Okay, pharynx and larynx very important for head and neck chapter. So you can expect some questions from pharynx. Now, before going to the pharynx, what exactly you have to study? Okay, exactly what you have to know about the pharynx? First, let's see what are the points. Okay, because if you read any of the textbooks, so many points, so many things are given about the pharynx. Okay, if you have seen any book, so exactly what you have to study, what are the points? First, let's discuss about that, and then we'll go to the pharynx. Okay, so these are the points under which we have to discuss about the pharynx. Okay, first of all, you have to know what is the exact location of the pharynx, where the pharynx is located. Okay, that will be covered in the introduction. Then, what is the extent of the pharynx, from where to where the pharynx is extended. Okay, so let me tell. Can anyone tell me what will be which type of structure is pharynx? No, no. What will be the shape of the pharynx? Circular, oval, triangular? Huh? Not exactly. Actually, it is tubular in shape. Okay. Pharynx जो होता है उसका shape कैसा होता है? Tubular in shape. Why it appears funnel shaped? Because the upper part is broader. Okay, and the lower part is narrower. That's why it appears as funnel shaped. But mostly it is tubular in shape. Okay, so if anyone asks you what is pharynx, your answer will be it is musculomembranous tube. Okay, the pharynx is a tubular structure, musculomembranous tube. Now if you see the upper part, it is expanded. Okay. So I will request everyone, please note down these points. Okay. Uh, Next, the dimensions. So dimension is, though it is a tube, so how to measure the dimension? We have to measure the length of the tube and we have to know the diameter of the tube. Those will come in the dimension. Okay. Next, the boundaries. So if it is a tube, so it will be having certain boundaries, right? So it will be having superior boundary, it will be having inferior boundary, or also roof, floor. Okay. So in the boundaries, we have to know what is the roof, then what is present inferiorly, what is present anteriorly, and what is present posteriorly. Okay. Next, several times I have mentioned that pharynx is divided into three parts. If you remember, pharynx का कितना part होता है? How many parts are there? Last bench, how many parts are there in the pharynx? Please pay attention. How many parts are there in the pharynx? Three parts are there. Okay. Nasopharynx, Oropharynx and Laryngopharynx. Three parts are there, right? So that's why I have written about the subdivisions of the pharynx. So here most of the students used to get confused because see, I have written boundaries twice. The first boundary is for the entire pharynx, ऊपर से लेके नीचे तक, जहाँ से start होता है pharynx, जहाँ तक खत्म होता है, entire pharynx. The first you have to know about the boundary. Next, you have to know about the subdivision. Three subdivisions are there. Okay. Though again, you have to know about the boundaries of those three subdivisions. Okay. So don't get confused. For example, nasopharynx, it is having different boundaries. Oropharynx boundaries are different. Laryngopharynx boundaries are different. Okay. So like this, each and every division of the pharynx, you have to know about the boundaries. Next, some important features. For example, when you are looking at the nasopharynx, when you are looking at the oropharynx, क्या दिखाई देगा? What you can see or what you can expected to see in those particular subdivisions of the pharynx. Okay, that will come under the features of nasopharynx or oropharynx. तो एग्जाम में क्वेश्चंस आ सकता है for 5 marks. Describe the pharynx, describe the features of nasopharynx, or describe the features of nasopharynx and oropharynx with clinical importance. ऐसे क्वेश्चन आता है. Okay, so at that time you have to make only at that time you forget about the boundaries of everything. अगर nasopharynx का आया, just write the boundaries nasopharynx, then the features what you can see and related clinical aspect of those features. Okay, that will come under the subdivisions and the boundaries. Okay, once it is done, as I said, it is a tubular structure. Okay. Now, if a tubular structure is there, you can take the TS. Tubular structure का TS होता है. We have studied in blood vessel histology, if you remember. So it is also tubular structure, right? Now, suppose you have taken a TS, and then if you see, can you see the layers? Yes. In blood vessel, how we have seen those layers? We have taken the TS, then we have seen the layers. So same, ये भी tubular structure है. If you take TS or LS, what you can see? You can see the layers. तो जो pharynx होता है उसमें from inside to outside. Okay, from inside to outside, how many layers are there? 5 layers are there. Okay, in the pharynx. Among them, one layer is there where muscles are placed. Okay, so the muscle layer, 3 groups of muscles are there in each part. So the muscle layer is having 3 muscles in the internal layer, 3 muscles in the external layer. Like this the muscles are arranged. Okay. So here we have to discuss about the muscles of the pharynx. If you remember the way we have discussed about the muscles of soft palate, in the similar way we have to discuss about the muscles of pharynx. Okay. That also in 2 different layers, internal layer and external layer, and they are having very important function. Every day whenever you are swallowing, okay, whenever you are swallowing, at that time those muscles are acting. If those muscles are not acting, you can't swallow. Okay, so those muscles are very important. Next, once this is done, then the part is very simple: nerve supply, blood supply, lymphatics applied, and this is the functional aspect of the pharynx. That is the process of deglutition or the process of swallowing, where three different stages are there. Okay, so unless and until you understand the entire structure of the pharynx, along with that what are the structure associated with that, you will not be able to understand about the stages of deglutition. That's why I have kept it separately. First I will finish everything, then we will discuss about the stages of deglutition. Have you studied this one in physiology? Anyone? Stages of deglutition? Sure. In physiology, have you studied? I know you have studied. See, few students have said yes, few students are saying no. फिजियोलॉजी क्लास यहाँ पे ही होता है, सबका एक साथ होता है. See, there is a difference. Some students are saying yes, I know you have studied this in physiology. Okay, that is the importance, how you are attending the class. Okay, that shows how you are present in the class, either physically or mentally. Anyway, not waste much time. So I'll start with the pharynx. So first, what is the shape of the pharynx? As I said, it is a tubular structure, musculo-membranous. Musculo-membranous means it is made up of muscle as well as membranes are also there. Okay, and internally, if you see the pharynx, it is lined by mucous membrane. Okay, that means you will be getting the lining epithelium over there. Okay. Now, what do you think, from where to where it will extend? The pharynx कहाँ से कहाँ तक extend होगा pharynx का? Tubular structure है, तो any tubular structure you know that उसका एक origin होगा, उसका एक termination होगा. Means यहाँ से origin हो रहा है, यहाँ जाके terminate होगा. Okay, and that particular part will be the extent of that particular tubular structure. Okay, so in case of pharynx, as you can see, it is extending from the base of the skull. Now you are studying norma basalis. You have started studying norma basalis, right? So it is extending from the base of the skull to the 6th cervical vertebra. Cervical vertebra is done. You have studied about cervical vertebra, right? So from the base of the skull to the 6th cervical vertebra, that is the extent of the pharynx. Okay. Now pharynx continues as what? Pharynx जो होता है after 6th cervical vertebra, it continues as what? Esophagus. Okay, esophagus you have studied. You know that it is the continuation of the pharynx below the 6th cervical vertebra. Okay. Next, as you can see, the interior of the pharynx. Now, from exterior, the divisions are not done. Divisions are done based on the structures which are present on the interior of the pharynx. Okay. Based on that, the pharynx is divided into three parts. What are those three parts? As you can see, Nasopharynx, Oropharynx and Laryngopharynx. Okay. Oropharynx is very important. Why it is important? Because it serves as a common passage for air and food. So whatever we are inhaling and whatever we are swallowing, the common passage is the oropharynx. Okay. So I will show you the common passage, because and here the crossing over is taking place. Okay, and it is a common passage for both air and the food. Okay. Next, as you can see, the pharynx forms the cephalic part of the alimentary tube. Okay, the most cephalic part of the alimentary tube is formed by the pharynx. If you have studied about the esophagus. Okay. Now, the pharynx represents the backward extension of the nasal cavity and functionally belongs to the respiratory system. So, the nasal cavity which is there, the posterior extent of the nasal cavity is nothing but the nasopharynx. Okay. So, two systems are interconnected to each other by the help of the pharynx. Okay. And this particular part is lined by respiratory epithelium. Okay. So only this part is lined by respiratory epithelium. Rest entire part of the pharynx is lined by stratified squamous non-keratinized epithelium. Okay. Now already I mentioned pharynx acts as a common channel for both deglutition and respiration. And now which part of the pharynx is acting as a common pathway? That is oropharynx. Okay. Now here you can see the extent of the pharynx. I hope you can see the diagram. Yes. Now in this diagram you can see, so this is the base of the skull. From the base of the skull it is extending downwards, okay, up to 6 cervical vertebra. Beyond that, it continues as esophagus. Okay, so this is the pharynx, and this is with the larynx, and larynx continues as trachea. Larynx जो होता है that continues as trachea, pharynx continues as esophagus. Okay, those student having doubt, note it down. Okay, because I have seen student used to get confused. So important points, make it a habit to note it down. Next, here you can see the common passage. Can you see the common passage over here in this diagram? Here also you can see the common passage. Okay, so this is the nasal cavity. This particular part, posterior aspect of the nasal cavity, that is the nasopharynx. Posterior aspect of the oral cavity, that is the oropharynx, and posterior aspect of the larynx, that is the laryngopharynx. Okay. Now in this particular part, okay, I am talking about the oropharynx. It is a common channel or common passage through which air and food both are passing. So which one is going in which direction? Can you see in the diagram? To see the crossing over is taking place like this. Okay. So here the food is going posteriorly. The air is coming anteriorly, because you have studied that trachea is present anteriorly, esophagus is present posteriorly. You have studied the mediastinum, right? So in mediastinum, if you have studied the relations of the structure present, especially in the superior mediastinum, then you have noticed that trachea is situated always anterior and esophagus is situated posteriorly. Okay, this is the reason. Okay, so here you have seen the extent of the pharynx. Now what we have to study? Now we have to study about the boundaries of the pharynx as a whole. Okay, first you have to study the boundaries of the pharynx as a whole. For example, if I ask you what will be the boundary of this pharynx, so here you can see this will be the roof. ऊपर रहता है, this will be the roof. This will be the posterior wall. Here you will be getting the anterior wall, and then inferiorly, as you can see, it is continuing as esophagus. So those will form the whole overall boundary of the pharynx. Okay. Next, can you see the nasopharynx? Here देखो nasopharynx. Here also you can see this particular part is the nasopharynx. Next, we have to discuss about the boundaries of each and every division of the pharynx. Okay. So you have to understand this particular part without getting confused. Okay. So first in the boundaries. Now, can anyone tell me what will be the length of the pharynx? Any idea? यहाँ से लेके यहाँ तक C6. What will be the length? Approximately 15 centimeter. Okay. Don't write exact. Approximately 15 centimeter. Okay. Approximately it is 12 to 15 centimeter. What will be the diameter? Tube है, तो tube का diameter होगा. So what will be the diameter? As I said, the upper part is broader, lower part is narrower. जो pharynx होता है उसका जो upper part है that is broader, lower part is narrower. Okay, so according to that you have to mention the diameter. Whenever you are writing about the diameter of the pharynx, you can't write that each and every part it is 3.5 centimeter. No, upper part is 3.5 centimeter. Okay, and the lower part is only 1.5 centimeter. Okay, so that is the variation in case of pharynx. Though if you see the dimension of the pharynx, as I said, the length 12 to 14 centimeter, or approximately in some books I have seen it is given as 15 centimeter. Okay. Next, if you see the maximum width, okay, that is 3.5 centimeter in case of nasopharynx. So the nasopharyngeal part of the pharynx, the width is more, approximately 3.5 centimeter. Now the minimum width is only 1.5 centimeter, that is the pharyngo-esophageal junction, जहाँ पे pharynx खत्म होता है, esophagus start होता है. Okay, that particular part is very narrow, only 1.5 centimeter. Okay, so that is the narrowest part of the pharynx. Next, so what will be the location of the pharynx? what will be the location of the pharynx? कहाँ पे मिलेगा pharynx? It is a tube, right? As I have mentioned, extending from the base of the skull to the 6 cervical vertebra. That is the extent. Now what will be the location? So if you go posterior to nasal cavity, you will be getting the pharynx. If you go posterior to the oral cavity, you will be getting the pharynx. If you go posterior to the laryngeal cavity or larynx, then also you will be getting the pharynx. So that is the location of the pharynx. That's it. Okay. So location is not that difficult. Okay. So here you can see it is situated behind the cavities of nose, mouth and larynx, and anteriorly it is communicating with those of the cavities. Okay. Next, already I mentioned that pharynx is divided into 3 parts. Okay. Now how it is divided into 3 parts? Nasopharynx का मतलब क्या है? The part of the pharynx situated behind the nasal cavity, that is the nasopharynx. Part which is situated behind the oral cavity, oropharynx. Part situated behind the laryngeal cavity, laryngopharynx. Very simple to understand. Okay. So here you can see these are the divisions of the. In this diagram you can see these are the divisions of the pharynx. Okay. Now here also you can see the nasopharynx, you can see the oropharynx, and you can see the hypopharynx, or also called as laryngopharynx. Okay. Next, the boundaries. Okay, overall boundary of the pharynx. Okay. So in overall boundaries, what you have to know, when I have shown you the diagram, what is present superiorly, what is present inferiorly, what is present posteriorly, and what is present anteriorly. Okay. Boundary का मतलब क्या होता है? If I ask you what are the boundaries of this class, what will be your answer? So these walls are the boundaries of this class, right? So similarly, imagine yourself, you are standing inside the pharynx. Okay. So whatever you will see in front, that will be the anterior boundary, where it will communicate with the different cavities. Posteriorly, what you will be getting? You will be getting the vertebral column. Which part of the vertebral column? Cervical vertebral. Okay. ऊपर क्या रहेगा? Base of the skull रहेगा. नीचे क्या रहेगा? Esophagus. It will continue the esophagus. That is the boundary. Just imagine what can be the boundary. You don't have to see this one. You don't have to by heart. Like this you can write in the exam. Okay. तो ये देखो superiorly, as I said, base of the skull रहेगा. Okay. Which I have shown you in the diagram. Next, inferiorly it continues as esophagus at the level of 6 cervical vertebrae. Anteriorly क्या होगा? And posteriorly paravertebral fascia separated from the cervical vertebral bodies. Cervical vertebral column रहेगा, which is separated from the pharynx by this prevertebral fascia, and anteriorly all those cavities will be present through which it will be communicating. Simple. That is the boundaries. Okay. Next, on either side. Okay. Now on each side of the pharynx. So this I have shown you what is present anteriorly, what is present posteriorly, superiorly and inferiorly. What about both the sides? Structures are present on either side also. I am talking about the relations or structures present laterally. Okay. So here you can see the structures present laterally. Can anyone tell me what is this medial pterygoid plate? It is a part of, yes, it is a part of sphenoid bone. Because I know you have studied about the norma basilis, where you have studied the sphenoid bone. Okay, so medial pterygoid plate is a part of sphenoid bone. Then pterygomandibular raphe. Have you heard about this pterygomandibular raphe? I know you have studied pterygomandibular raphe. You have not studied mandible. हाँ, तो mandible में attachment नहीं रहता है pterygomandibular raphe का तो. Okay, recall whatever you have studied, correlate. So laterally we are getting the pterygomandibular raphe. Then we are getting mandible on either side, then hyoid bone, thyroid and cricoid cartilages. Okay, so from above, below, these are the structures situated on either side of the pharynx. Okay, then you can see communicates. Now this is very important. So I have mentioned that pharynx is communicating anteriorly with nasal cavity, oral cavity. Okay, and through laryngeal inlet also the communication is there. but there is a very important, those communications are on the anterior aspect. Lateral communication भी रहता है of the pharynx. Which part of the pharynx? Nasopharynx. It is with auditory tube, or also called as pharyngotympanic tube. Okay, so a tube is there which is connecting the nasopharynx to the middle ear cavity. Okay, and that is called as auditory tube, or also called as pharyngotympanic tube. Some part is made up of bone, some part is cartilaginous in nature. Okay, you have to study about that also, auditory tube. Okay, don't worry, after completion of the pharynx we will discuss about this auditory tube. Okay, so that is also a very important connection, don't forget. Okay, short question यहाँ से आता है, that name the lateral connection of the pharynx. So this will come under lateral connection, means laterally it is connected to the auditory tube, anteriorly with the cavities, oral cavity, nasal cavity. Okay. Now here you can see the structures which are situated on the lateral aspect of the pharynx. Okay. So from here the pharynx will start. Okay. So like this it is extending downwards on both the side. As you can see, first of all we are getting the mandible. So this particular part of the mandible is removed so that you can see the other structures. Then if you go below, then you can see the hyoid bone also. Okay. Then you can see the cartilages. This is the thyroid cartilage, this is the cricoid cartilage. Okay, so these are the structures situated on the either side. Okay, or you can say on the lateral aspect of the pharynx. And here easily you can see the pterygomandibular raphe. See this one. Okay. Okay. So now we'll start with the nasopharynx. So nasopharynx, already I have told you 3 subdivisions are there: nasopharynx, oropharynx and laryngopharynx. So first subdivision is the nasopharynx. Okay, तो कहाँ पे रहता है nasopharynx? Where the nasopharynx is situated? Behind the nasal cavity. Okay, तो posterior nasal aperture is there, or also called as guanae. Posterior, when we will study the nasal cavity, that time we will come to know that a posterior nasal aperture is there, it is called as guanae. Okay, now just behind the posterior nasal aperture we are getting the nasopharynx. Okay, now here also you can see the boundaries. First let me show you the diagram. Now here can you see the nasopharynx? This is the sagittal section of the neck. Okay, extending from the upper part. Now can you see the nasopharynx? So this particular part is the nasopharynx, this particular part is the oropharynx, and this is the laryngopharynx. Okay, now I will request everyone to please concentrate over here. Okay, so 2 diagrams are present. With the help of these 2 diagrams we will try to understand the boundaries of nasopharynx, right? Can you see the nasal cavity? Okay, so as I said, 3 divisions are there. So this is the nasopharynx. Everyone please concentrate over here. With the help of this diagram, first we will try to understand the boundaries. Next, can you see some thing which are shown over here? Okay, see this one. Can you see? So this will be the features of the nasopharynx. 2 things as I have mentioned over here also. First subdivision, then subdivision ka boundaries, and then what are the features present in that particular subdivision. Okay, and whenever you are writing you can't mix. For example, if you are writing the features of nasopharynx, you can't write the features of the oropharynx. Okay, you have to be very specific, right? So that's why please see the boundaries. So how to define the boundary of the nasopharynx? First we will see what is present superiorly. Okay, and then we will see what is present posteriorly, after that anteriorly and inferiorly. That is the boundary, nothing else. So how the roof is formed? As you can see, body of the sphenoid and basilar part of the occipital bone, this particular part will form the roof. Okay, body of the sphenoid and basilar part of the occipital bone, that will be forming the roof. Okay. Next, what is the posterior border, or how the posterior part is formed? As you can see, the posterior part is mainly formed by the first cervical vertebra. Okay, you can't write all because they are going downwards, so they will forming the posterior wall of the oropharynx and then laryngopharynx. Okay. Next, the floor. Okay, so this will be the floor. Okay, so how the floor is formed from the anterior to posterior? First of all, it will be formed by the soft palate, upper surface of the soft palate, and along with that, the pharyngeal isthmus. So here we will be getting the pharyngeal isthmus. Pharyngeal isthmus, actually it is a narrow passage through which nasopharynx is communicating with the oropharynx. जो nasopharynx है, oropharynx है, उसका जो communication है, in between that the passage which is present, that is called as nasopharyngeal isthmus. Okay, so that nasopharyngeal isthmus and the upper surface of the soft palate will form the floor over here. Okay, तो ये देखो ऐसे floor form हो रहा है. So here we are getting the soft palate, and here nasopharyngeal isthmus will be there. So this particular part will form the floor. This is forming the roof, and here is the what? Here we are getting the posterior wall. Okay. Next, what is left? Next is left the anterior wall. Now for the anterior wall, please focus on this particular diagram. Here you can see Huane, or also called as posterior nasal aperture. Okay. So this posterior nasal aperture is forming the anterior wall. यहाँ पे रहेंगे. Okay. इससे पहले this is the nasal cavity. Beyond that is the nasopharynx. Okay. So always in case of pharynx, see the diagram and see the boundaries. Compare with the diagram, and then study. You will understand. Or else you will keep on by hearting and you will keep on forgetting. Okay. So we have seen what is present in the anterior wall. Anterior wall, as I said, the posterior nasal aperture and posterior edge of the nasal septum. As you can see, here posterior edge of the nasal septum is present. That is forming the anterior wall. Posterior wall में क्या रहता है? Only C1, first cervical vertebra is present. As you can see in the diagram. Okay, you can't write all the cervical vertebra. Okay. Next, the lateral wall. Okay, lateral wall is also there. So we have seen what is present in the roof, we have seen what is present in the floor, then anterior wall, posterior wall. What about the lateral wall? Lateral wall we have. So how the lateral wall will be formed? Lateral wall is formed by the medial pterygoid plate of the sphenoid bone. ये देखो, this is the medial pterygoid plate, this is the lateral pterygoid plate. Okay, so this medial pterygoid plate is forming the lateral wall of the nasopharynx. Okay, so this is the entire boundary of the nasopharynx. Next, along with the boundaries of the nasopharynx, once the boundaries are defined, then what you will see? I will give an example. Suppose this is lecture hall 1, that is lecture hall 2. Okay? How you can say that this is 1 or this is and this is 2? First of all, boundaries are there. अगर मान लो boundary नहीं है, तो you can't say this is 1 and this is 2, right? So first we have defined the boundary, means the boundaries are formed. Once boundaries are formed, then you have entered the classroom. Once you enter the classroom, you can see all the objects present inside the classroom. Okay. In that classroom also, when you enter, you will see some objects are present. Okay. So in the similar way, when you have entered the nasopharynx, okay, now you are in this classroom, suppose in the nasopharynx. So in the nasopharynx, you can see some objects are present. So here we don't call it an object, we call it as features. Okay, as you can see in the diagram. So this will be the features of the nasopharynx. Okay. Now again a problem is there. And what is that problem? Directly you can't mention all the features. Then how to mention the features? Any idea? You can't write that these are the features of the nasopharynx. For that again you have to go to the various boundaries. Okay. For example, roof में क्या features है, floor में क्या features है, lateral wall में क्या feature है, anterior wall में क्या features है. Like this you have to go. Okay, and these are very specific. Okay, repeatedly I am mentioning about the boundaries and about the features. Whenever you are writing, it should be very specific. Don't mix it. If you are mixing, then gone. इसका कोई मतलब नहीं निकलेगा. Okay, it will doesn't make any sense. So first, what we have to see, the features. So in the boundary, what was the first? बाउंड्री में पहले कौन सा बाउंड्री डिफाइन किया था? रूफ. बाउंड्री में पहले कौन सा डिफाइन किया था मैंने? फर्स्ट रूफ. तो हियर आल्सो वी विल सी द फीचर्स ऑफ द रूफ. कैन यू आइडेंटिफाई द रूफ ओवर हियर इन द डायग्राम? नेसोफेरिंक्स का. Can you identify the roof of the nasopharynx? Yes. So this particular part is the roof, and then here roof is continuing downwards as posterior border also. Okay. So at the junction of the roof and the posterior border, roof ऐसे continue होके downward में posterior border form कर रहा है. Okay. So at the junction, what we are getting? We are getting a structure. Can you see that structure? What does it called? It is called as pharyngeal tonsil. Here you will be getting the aggregation of lymphoid tissue, that is called as pharyngeal tonsil. Okay, as you can see over here. Okay, pharyngeal tonsil also called as nasopharyngeal tonsil, because that aggregation of lymphoid tissue is present inside the nasopharynx. Okay, next a mucus diverticulum is there, which is extending from the apex of the nasopharyngeal tonsil, and it is called as nasopharyngeal bursa. Okay, it is called as nasopharyngeal bursa. Let me show you another diagram. Yeah. Okay, so these are the diagrams in which you can see the various features present in the nasopharynx. Okay, and these diagrams I have collected from some books, so that during the time of exam you can draw, because exam में diagram भी draw करना, you have to draw the diagram. Okay, and see these are the easy drawable diagrams, not 3D diagrams. Okay, this diagram you can draw. So can you see the roof? ये देखो, this is the pharyngeal tonsil. Okay, and in this diagram you can see a mucus diverticulum is there, and that is called as pharyngeal bursa. Okay, not the bursa which you have studied in case of joint. Okay, just a diverticulum, mucosal diverticulum, that is called as pharyngeal bursa. Now how it is formed? Now it is formed by the notochord, adhesion of the notochord to the proximal part of the foregut, pharyngeal part of the foregut. जो notochord होता है उसका adhesion होता है to the pharyngeal part of the foregut. At that time this diverticulum is formed. Now it is having a clinical significance that we will discuss in the applied anatomy part. Okay, so that is the pharyngeal bursa. Okay, next on the lateral wall. Okay, if you go to the lateral wall, approximately 1.25 centimeter behind the inferior nasal concave, in the nasal cavity, especially in the lateral wall of the nose. Okay, you will see that there are some shelf-like projection. Okay, bony projection. 3 shelf-like bony projections are there. Okay, see these are the shelf-like bony projection. So the inferior, these are called as nasal concave. Okay, so superior, middle and inferior, 3 nasal concha are there. So the inferior nasal concha, take the inferior nasal concha, go posteriorly 1.25 centimeter behind it on the lateral wall. Okay, what you are getting? You are getting a opening, and that is the opening for the auditory tube. Okay, an opening is there, and that opening is for the auditory tube. That auditory tube which is connecting the nasopharynx to the middle ear cavity. Okay, so uska jo opening hai, that is present over here. Now above the opening, okay, now upper and posterior margin of this opening is bounded by a elevation. Okay, as you can see, so this is the opening, and this opening is bounded by a elevation that is called as tubal elevation. How the elevation is formed? Again here you can see aggregation of lymphoid follicles or lymphoid tissue. Okay, and this tonsil is called as tubal tonsil. This is called as tubal tonsil. Okay, so this was the pharyngeal tonsil, and this is the tubal tonsil. Okay, so tubal tonsil कैसे form होता है? Aggregation of the lymphoid follicles. Okay, around the tubal opening. That is called as tubal tonsil. Next, Now, two fold of mucous membrane, as you can see, it is extending downwards, okay, from the tubal tonsil. ये देखो here, okay. So this is the sulfingo-palatine fold, and this is the sulfingo-pharyngeus fold. Okay. Now in the sulfingo-pharyngeus fold, sulfingo-pharyngeus muscle is there, and in sulfingo-palatine fold, can you guess which muscle is present? It is levator villi palatini muscle is present. The muscle which you have studied in the soft palate. Okay. So these are some important features which are present in the nasopharynx. Next is the pharyngeal recess. Okay. So here you can see this is the pharyngeal recess. Okay. तो pharyngeal recess is a deep depression behind the tubal elevation. तो जो tubal elevation होता है behind that a recess is there, that is called as pharyngeal recess, or also called as fossa of Rosenmuller. In some books it is given as fossa of Rosenmuller or pharyngeal recess, posterior to the tubal elevation. Okay. So these are some important features. Next, another important feature is there which you can see in the floor of the nasopharynx. Okay, in the floor of the nasopharynx. So this is the floor of the nasopharynx. So in the floor of the nasopharynx, one important feature is present. Okay, here you can see this is called as pharyngeal isthmus. Okay, this is called as pharyngeal isthmus, which is a passage, and through that isthmus, the nasopharynx is communicating with the oropharynx. Nasopharynx and oropharynx communicates with each other through that gap. Okay, that is called as pharyngeal isthmus. Now, if you see the pharyngeal isthmus, how it is formed, it is formed mainly by the posterior surface of the free end of the soft palate and by the passadance ridge. Okay, so here you can see this is the pharyngeal isthmus. Okay, anteriorly it is bounded by the free end of the soft palate, posteriorly by the passadance ridge. Passadance ridge we have discussed in the last class. Okay, so this particular part. Now during deglutition, whenever you are swallowing, so this used to get closed. Okay, so that whatever we are swallowing, it can't go back into the nasal cavity. That is the importance of the pharyngeal isthmus. Okay. Now whenever we are swallowing, at that time, as I said, it gets closed by the active contraction of the muscles of the soft palate. For example, levator villi palatini, tensor villi palatini, and palatopharyngeus muscle. That was the sphincteric part of the palatopharyngeus muscle. Those helps in closing this pharyngeal isthmus. Very important during the time of deglutition, swallowing. Okay. So that is about the features of nasopharynx. Okay, so this one already I have shown you. Now here you can see the pharyngeal or nasopharyngeal isthmus. Okay, so we have discussed about the pharyngeal or nasopharyngeal isthmus. Now this particular feature is present in the floor of the nasopharynx. Okay, so see, first in the nasopharynx we have defined the boundary. Then in each and every boundary, okay, the important features, whatever it was present, we have discussed about the important features. Like this we have to proceed. So after nasopharynx, what is the next part? After nasopharynx, what is the next part? Oropharynx, not laryngopharynx. After nasopharynx, next part is the oropharynx. Okay. Can you identify the oropharynx over here? Can you see the oropharynx? So if you see the pharyngeal isthmus, ये जो pharyngeal isthmus, इसका जो नीचे वाला part है, okay, and see two isthmus are present over here. If you see the diagram, that's why I've shown you this diagram. First is the pharyngeal isthmus, and second one is the oropharyngeal isthmus. Okay, so the area situated behind the oropharyngeal isthmus and below the pharyngeal isthmus. Okay, so that particular part you have to focus because that is the oropharynx. Okay, so this particular part is the oropharynx. So now we have to discuss about the oropharynx. So how to study the oropharynx? In the similar way how we have discussed the nasopharynx. So first what we will discuss? First we will discuss the boundaries of the oropharynx. Okay? Next the features of the oropharynx. Similar way we have to discuss about the laryngopharynx also. Now the oropharynx, where it is situated? It is situated behind the oral cavity. This is the oral cavity. Behind the oral cavity, the oropharynx is situated. Okay. Now it is supported posteriorly from C2 C3 vertebra and retropharyngeal space. So जो pharynx होता है, ठीक pharynx के पीछे vertebral column होता है, but there is a space in between the pharynx and the vertebral column, that is called as retropharyngeal space. उसमें क्या रहता है? Any idea? Adipose tissue रहता है, fat रहता है, and along with that some lymphatics are present. Now the question is, why that space is given? Pharynx is a muscular tube. Whenever you are swallowing, it will distend. Okay, so that space is provided by the retropharyngeal space. Okay, next in the oropharynx, so you can see it lies behind the oral cavity and it is supported by C2 C3 vertebra, and along with that some contents of the retropharyngeal space. Okay, now so from where to where the oropharynx is extended, means what is the extent of the oropharynx? So as you can see, it extends from the lower surface of the soft palate above to the upper border of the epiglottis below. Okay, तो जो soft palate है, lower border of the soft palate to the upper border of the epiglottis, that is the extent of oropharynx. Okay, very important line. Lower surface of the soft palate, upper border of the epiglottis, that is the extent of the oropharynx. Now oropharynx anteriorly it will communicate with what? Anteriorly it is communicating with the oral cavity through oropharyngeal isthmus. Superiorly it is communicating with the nasopharynx with pharyngeal isthmus. Okay, these are some communication. Now this oropharyngeal isthmus is closed during deglutition to prevent the regurgitation of food from the pharynx to the mouth. Okay, so जो oropharyngeal isthmus है, it is also closed during the time of deglutition, so that regurgitation or back flow of the food will not take place in the oral cavity. Okay, now below it is communicating with the laryngopharynx at the level of upper border of the epiglottis, so that is also a communication of the oropharynx. Okay, oropharynx is communicating with the laryngopharynx where below the upper border of the epiglottis. ठीक है, इसके नीचे जो पार्ट है that is the laryngopharynx. Next again you can see the borders. Okay, the boundaries. Okay, that is here also we are having roof, we are having floor, anterior wall, okay, posterior wall, lateral wall, all these structures are present. Okay, now let's see the diagram. Yeah, can you see the diagram? Now in the diagram can you tell me what will be the roof of the oropharynx? यहाँ पे oropharynx कौन सा है? I am asking in this diagram, where is the oropharynx? Can you see that sky color area? ऐसा coloring नहीं रहता है, okay? But this is for your understanding, so that you can understand which part exactly is the oropharynx. Can you see the oropharynx? Yes. Now, so this small part we have to define the boundaries. तो पहले क्या आएगा? Roof. First we have to define the roof. Okay. So how the roof will be formed? Here you have to define the roof. So first of all, roof is formed by the soft palate. So here you can see the soft palate. So the under surface of the soft palate will form the roof. Okay, and along with that pharyngeal isthmus. This is the pharyngeal isthmus. Okay, so this is the roof. Okay, this is the roof of the oropharynx. How it is formed? As you can see, the soft palate, posterior part of the soft palate, and the pharyngeal isthmus. So this will be forming the roof of the oropharynx. Okay. Next, what about the floor? अगर roof है तो नीचे क्या रहेगा? Floor. This is the roof. This is the floor. Okay. So if roof is formed, then floor will also be there opposite. So floor is formed by what? Can you see the tongue over here? So posterior one third of the tongue, see posterior one third of the tongue will be forming the see ये पूरा tongue है, okay. So the posterior one third will be forming the floor, okay, along with that interval between the tongue and the epiglottis. So the area between the tongue and the epiglottis and the posterior one third of the tongue will form the floor of the oropharynx, okay. I hope you can see the epiglottis over here. I'm talking about this, okay. तो रूफ हो गया, फ्लोर हो गया, देन व्हाट इज प्रेजेंट एंटीरियर वॉल एंड पोस्टीरियर वॉल. Now anterior wall, if you see, actually it is communicating with the oral cavity, okay. So anterior wall, here we are getting the oropharyngeal isthmus which will communicate with the oral cavity, that is the anterior wall, okay. Next in the anterior wall, when it is communicating with the oral cavity, okay, so the posterior most part of the tongue or the pharyngeal part of the tongue will also present in the anterior wall, okay. Next is the posterior wall. Can you see the posterior wall is formed by mainly C1 and C2, okay. Mainly it will be formed by the C2 and C3, second and third cervical vertebra. Posteriorly क्या रहेगा, जो pharynx है, posterior to the pharynx what is present, as you can see, this is the posterior aspect, this is the anterior aspect. So posteriorly क्या रहेगा, as you can see, this is the second cervical vertebra and some part of the third cervical vertebra is also present, okay, which is forming the posterior wall. तो रूफ हो गया, फ्लोर हो गया, एंटीरियर वॉल हो गया, पोस्टीरियर वॉल हो गया. नेक्स्ट व्हाट इज रिमेनिंग, lateral, okay. Lateral means on each side. So on each side, how it is formed, it is formed by the pterygomandibular raphe, okay. Pterygomandibular raphe will be there, mandible is present and tongue is present. So these are the structures present on each side, okay. And below we are getting the hyoid bone also, okay. So those are the structures and I hope you can see the structures present on the lateral aspect, okay. So that is the boundaries of the oropharynx. And what is speciality in case of oropharynx? Oropharynx speciality क्या है? It is the common passage or common pathway for both air and food. Whatever we are inhaling and whatever we are eating, okay, the common passage is oropharynx, where I have shown you the crossing over is taking place, ठीक है. Now here, so this oropharynx, this particular part is the common pathway or common passage for food and air. Next boundaries are done. What is next? After boundaries के बाद क्या होता है? Features. In the nasopharynx we have seen the features. Now here also some features are present, but here the features are very less. Now the most important features which you can see over here. Can you tell me what is seen over here in the diagram? क्या दिखाई दे रहा है? अच्छे से दिखाई दे रहा है. That also in blue color. I am talking about this one, palatine tonsil. Okay, palatine tonsil is a important feature, okay, which is present on both the side, right side also, left side also, okay, in the oropharynx. So lateral wall present the palatine tonsil on either side, and it is situated in a triangular fossa, okay, also called as tonsillar fossa. And how it is formed? It is formed by the two folds, palatoglossal fold and palatopharyngeal fold. And in between these two folds, the palatine tonsil is present, which you can see in the diagram. Okay. Next, can you tell me what will be the other features? Any idea? Because you have studied the histology of tongue, तो which type of tonsil will be present? टंग का जो posterior 1/3 है उसमें क्या रहता है? Lingual tonsil. Very good. So here also on the anterior wall you will be getting the lingual tonsil. Okay. तो lateral wall में क्या रहेगा? Over here palatine tonsil. Anterior wall में क्या रहेगा? Lingual tonsil. Okay. Next, do you remember the connection of tongue and epiglottis? When we have discussed the gross anatomy of tongue, at that time I have shown you one diagram. In the diagram, I have shown you the connections between the tongue and the epiglottis. What is that? These are nothing but the glossoepiglottic folds, and in between them, so two glossoepiglottic folds are there. In between the glossoepiglottic folds, a depression is present that is called as valvula. Right? So those are the important features present on the anterior aspect of the oropharynx. Okay. So lingual tonsil is present on the anterior wall. Okay. Then upper free end of the epiglottis is situated behind the tongue. See, median and lateral glossoepiglottic fold connecting the anterior surface of the edges of epiglottis and the tongue respectively. So जो tongue होता है epiglottis है, they are connected to each other by these glossoepiglottic folds, and in between the glossoepiglottic folds a depression is present that is called as valvula. I know you have not revised the tongue because you guys are very busy, so please find some time and revise the tongue. What we have discussed, you will get the answer. Okay. Next, epiglottic valvula is also there, and then another important feature is the oropharyngeal isthmus that is also present on the anterior wall. Okay. Now, see, I am talking about this. So, this is the epiglottis and this is the tongue. In between them, here you can see this is the valvula. Okay, तो valvula जो है वो एक depression है, and on the either side of the valvula, glossoepiglottic folds are there. This is how the epiglottis is connected to the tongue. Very important during the time of deglutition. Okay, whenever we are swallowing. Okay. Next, oropharyngeal isthmus. Okay, oropharyngeal isthmus क्या होता है? Can you, by the way, can you see the oropharyngeal isthmus? It can be seen easily. I will show you the diagram. So what you have to do, stand in front of a mirror, open your mouth, protrude your tongue, you can see the oropharyngeal isthmus. Okay? So oropharyngeal isthmus क्या करता है? So it is a channel, or you can say a passage, small or narrow passage by which oral cavity is communicating to the oropharynx. That is the oropharyngeal isthmus. ठीक है? Now oropharyngeal isthmus का boundaries क्या होगा? What is present superiorly? What is present superiorly? As you can see, soft palate. Inferiorly क्या रहता है? Tongue. ये देखो tongue रहता है. दोनों साइड में क्या रहता है? Palatoglossal arch. Okay. As you can see, palatoglossal arch is there. So this is the oropharyngeal isthmus. You can see your oropharyngeal isthmus. ठीक है? So do one thing. Today, see, stand in front of the, not now. Stand in front of the mirror. Okay. Try to find out the boundaries of oropharyngeal isthmus. ठीक है? Not inside the classroom. Okay, so these are some important features of oropharynx. Okay. Now, after oropharynx, what is the next part? Okay, after oropharynx, next is the laryngopharynx. Okay. So, if you see the laryngopharynx, it extends from the upper border of the epiglottis to the lower border of the cricoid cartilage. Upper border of the epiglottis. So, see, this is the upper border of the epiglottis. Okay, to the lower border of the cricoid cartilage. So that is the extent of the laryngopharynx. Laryngopharynx is also called as hypopharynx. Okay, beyond that the pharynx continues as esophagus. ठीक है, यहाँ पे देखो. So this is the, I am talking about this particular part. So this is the oropharynx. Already we have discussed, if you remember, oropharynx. ठीक है. So this is the upper part of the epiglottis, and this is the cricoid cartilage. So this particular part is the laryngopharynx, or also called as hypopharynx. Beyond that, the pharynx continues as esophagus. Okay. Now here also you have to know the boundaries. So इसमें क्या कौन सा boundaries आएगा? Here we are getting the anterior wall. So this is the anterior wall. This is the posterior wall. Okay. And then on the either side we are getting the lateral walls. Okay. तो anterior wall में क्या रहेगा? As you can see, the inlet of the larynx is there, laryngeal inlet. See, this is the laryngeal inlet on the anterior wall. Okay, and posterior surface of the larynx. So this is the posterior surface of the larynx, which is forming the anterior wall. Posterior wall you can see C3, C4, C5, C6. These are the cervical vertebrae which are present on the posterior wall. Okay. So this is the anterior wall. This is the posterior wall of the laryngopharynx. Okay. And a lateral wall में क्या रहेगा? Here we are getting the thyroid cartilage, supported by thyroid cartilage and thyrohyoid membrane. Okay, on either side the thyroid cartilage will be present and thyrohyoid membrane is present. Okay, that is the boundaries of the laryngopharynx. Okay, okay. So in the next class we will continue with the features of the laryngopharynx, what is present, okay, inside the laryngopharynx, followed by the structure where we have to discuss about the layers of the pharynx, 5 layers. Okay, thank you.